My name is Katara Ryan, and my group members are Tricia McCullough and Anna Darling. Together, we will be presenting a systematic review of the PICO question: how does the performance of daily oral hygiene measures compared to the absence of daily oral hygiene measures in inpatient settings affect the patient's likelihood of developing pneumonia? All three of us have worked in both long-term care facilities and hospital settings. Across the board, we have noticed a lack of oral hygiene. In fact, the average nursing assistant spends 16 seconds brushing their residents' teeth, if this is even happening at all, despite the recommendation from the American Dental Association to brush for at least 2 minutes. This alarming statistic told us a change needs to be made. One dentist states, "You can measure quality in a nursing home by looking in people's mouths, because it's one of the last things to be taken care of." We were interested in what ill effects leaving out this essential task would cause to our patients. One of the potential effects is the development of pneumonia. Pneumonia is defined as an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, causing coughing, fever, chills, and difficulty breathing. Possible causes include bacteria, viruses, and fungi. Symptoms include chest pain, cough, fatigue, shortness of breath, nausea, and confusion. Among institutionalized patients, 41% die from pneumonia, theorized to be caused by the aspiration of bacteria in the oral cavity. Through this review, we will look at 6 different studies that aim to find a correlation between oral care and the development of pneumonia.
These 6 studies were found through PubMed and CNAs Complete, 2 different databases we accessed through the Carroll College Library. Our original PICO question involved only nursing home residents, but after difficulty finding research, we expanded the population to include patients of other inpatient settings as well, such as long-term care facilities and patients in intensive care units. Most of these studies are level 2 evidence, the highest level that can be obtained without including systematic reviews. Because not all of the studies are completely straightforward, we are going to review them each. Beginning with study number 1, the control group of nursing home residents received their standard oral care twice a day, while the intervention group received their usual oral hygiene routine, plus a 0.05% chlorhexidine containing oral rinse solution twice per day. Researchers were searching for the effect of this rinse on the incidence of aspiration pneumonia. Unfortunately, this study was inconclusive due to high rates of attrition and mortality. Skipping ahead to study number 4, researchers looked at routine oral care swabbing with sponges versus using a commercially prepared oral care kit and mechanically ventilated patients' development of pneumonia. There was found to be no statistical significance of difference between the 2 groups. However, going back to study number 2, also with nursing home residents, the intervention group was assigned to provide care from the Mouth Care Without a Battle program for 2 years. During the first year of this study, rates of pneumonia in the nursing homes who implemented the program decreased, but during the second year, those homes had a higher rate of pneumonia. One hypothesis for this is that those implementing the program did not complete it at the same level of quality. In study number 3, bacterial colonization of the tongue and the presence of calculus within the mouth were found to be 2 significant risk factors for the development of pneumonia in institutionalized adults. This suggests that oral care, and specifically removal of tongue coating, may help reduce one's risk for pneumonia by ridding the oral cavity of these pathogens. Study number 5 found that over a span of 4 weeks in geriatric care facilities, the use of a mucosal brush to clean residents' tongues increased their peak expiratory flow values, which was used to measure coughing ability. Therefore, by cleaning the tongue during oral care, patients are better able to cough out respiratory pathogens, thus decreasing their risk for pneumonia. In addition to this conclusion, however, after 3 months post-treatment, researchers found that the intervention group's values were still higher than those of the control group, but they had decreased from the time the study had ended. This suggests that in order to have the intended benefit of improving coughing ability, the intervention of tongue cleaning should continue. And finally, study number 6 provided standard oral care to the control group, and standard oral care with the addition of a professional oral cleaning for 30 minutes per week to the intervention group. The experimental group showed significant reduction in tongue coating index, bacterial concentration, and yearly prevalence of pneumonia hospitalizations that the control group did not show. Overall, the majority of our articles suggested in one way or another that proper oral care, especially of the tongue, may help to prevent pneumonia.
Although more research needs to be conducted, this is a problem we are seeing all across the board, whether it be from lack of time, lack of staff, or lack of proper training. Often we revert to answering call lights, giving pain medication, or responding to a code because those seem a little bit more important at the time than brushing someone's teeth. However, each of these times that oral care is being missed, bacteria is building up, and the risk of pneumonia is greater. Education is the first step that needs to happen in these facilities. We need to educate staff on proper oral hygiene and the effects it will have if not performed correctly or not at all. No matter how simple or mundane it seems, hands-on oral care training should be a part of all programs. We also need to educate patients on performing these cares themselves. This can include how long to brush for, what tools to use, and specific parts of the mouth to focus on. Another suggestion is having a designated oral care aide, similar to a shower or bath aide, whose job is solely to provide oral care to our most vulnerable patients. This would ensure the task is getting done each and every day, without being forgotten or ignored. In conclusion, we as nurses, certified nursing assistants, and healthcare workers of all kinds can perform an intervention that takes less than 5 minutes but plays such a vital role in our patient's health. Something so small can make such a big difference.